Asif. I am a psychology major, and my topic is women and healthcare. To be more specific, women and the difficulties they face while accessing healthcare in India. India is a land of diversity and paradoxes, which has made great strides in various sectors over the years. However, when it comes to healthcare access, women in India continue to face a myriad of challenges. Despite constitutional guarantees of equality, women often encounter barriers and discrimination in accessing healthcare services. My talks explores the difficulties faced by women in accessing healthcare in India and the impact these challenges have on their overall well-being. To begin with, my experience with accessing healthcare has not been very pleasant. A few years ago, when I started feeling lethargic and sleepy all day, I was told that I was only being lazy, to the point that I still suffer from the embarrassment of the label. I was sleeping for long hours, sometimes 18 hours each day, and still being able to fall asleep at night just fine. I knew it wasn't me being lazy, it was simply something I couldn't control. My parents were often mad at me for sleeping so much, to the point that it got too much and they took me to a physician. While they said I was sleeping for very long hours, they also emphasized on I doing nothing all day and not realizing that it was only a symptom. Despite mentioning multiple times that if I could control it, I would, they wouldn't believe me. After all, what normal person would enjoy feeling lethargic and sleeping drowsy all day and all night long? Most of the time, people didn't just call me lazy. Sometimes they said it was because of the phone, although they didn't understand why it was happening to me or why I was doing so. Not once did anyone mention taking me to a doctor. They took me to a physician after I had pushed them and convinced them that the doctor would know exactly why it was happening. Not very convinced and persistent, believing that I'm only lazy, they took me to a physician only for the physician to diagnose me with anemia and prescribed supplements for my iron deficiency. I took these supplements for a month or two, and then I was able to stop, feeling much better already. Another incident that comes to light is a few years ago, I started having breathing issues where I just get up at night with breathlessness, with a physical feeling where I couldn't feel the air reach my lungs. I went on facing the same issue for days and nights, and yet again I was told that it was because my father had the same problem, and it only goes away with working out and breathing exercises. Having done it all and facing it very often for months, I was convinced it was something else. All over again, I had to go through the process of convincing my parents, as an adult this time, to take me to a physician. This time, I got my CBC done and figured out that my iron levels were low again. And all of this, at the end of the day, only made me realize that at least I know now that when I feel so and so, this is what is exactly happening in my body. It wasn't just me. I had observed this specifically with women in my family who were either not allowed to go to a doctor because they relied on another man or elder of a family to go with, because the other family members didn't think they had a problem and were just exaggerating the issue, and they endured the pain until it got severe that they needed to see a doctor, and so much more. Having observed and experienced this, I started asking other women if they went through similar experiences, and to my surprise, a lot of yeses. The fact that women constantly keep pushing the threshold of pain surprises me, especially when it comes to medical conditions. Different women have different stories. This is mine, and whether or not the same, there's inevitable inequality women face while trying to access healthcare. One of the primary hurdles women face in accessing healthcare is deeply rooted in socio-cultural norms. Traditional gender roles and patriarchal attitudes can restrict women's autonomy, making it difficult for them to seek medical attention. In India, cultural taboos and practices play a significant role in shaping the way women perceive and approach their health concerns. These deeply ingrained beliefs and norms often discourage women from openly discussing their health issues, resulting in delayed diagnosis and treatment. Several factors contribute to this phenomenon, such as the stigma surrounding women's health. Topics related to menstruation, sexual health, and reproductive organs are often shrouded in secrecy and silence. As a result, women may feel embarrassed or ashamed to seek medical advice for problems related to these areas. Women may also fear social judgment or ostracization if they discuss certain health problems openly. The fear of being labeled impure or defective due to health issues such as infertility can be deeply distressing for women. Consequently, they may choose to suffer in silence rather than facing potential isolation from their communities. Such cultural taboos can perpetuate a lack of knowledge and awareness about women's health. In conservative settings, health education, especially regarding reproductive health, may be limited or non-existent. This lack of awareness leads to misconceptions and myths about health concerns, making women hesitant to share their issues with others, including healthcare providers. In addition, traditional gender roles and expectations often dictate that women should prioritize the needs of their families over their own well-being. As a result, women may downplay their health concerns or delay seeking medical attention to avoid disrupting household responsibilities or being perceived as weak. To further complicate issues, in many patriarchal societies, women's autonomy over their bodies and healthcare decisions may be restricted. The final say in healthcare matters might lie with male family members, which can lead to delayed or inappropriate treatment for women. Elders and authority figures in traditional households often have a significant impact on decision making, including matters related to health. If elders discourage discussing health concerns openly, it can deter women from seeking timely medical attention. In close-knit communities, maintaining privacy and confidentiality can be challenging. Women may worry that discussing their health concerns openly could lead to rumors and gossip, causing unnecessary stress and embarrassment. Lastly, there is the overarching issue of underfunding for women's health research, which is very superficial. On a deeper level, the stigma is rooted in thousands of years of history. Maria, a woman who went through a similar experience, shared her story with Siddharth Sinai, a nonprofit academic healthcare organization based out of South Carolina, where she said, "For 8 months, my abdomen was getting bigger and bigger, and it was hard. Being told there was nothing wrong with me, that I was just going to have to get used to my ever-expanding belly, that I had IBS, and I was just obese. I had a 25-pound ovarian tumor. So it was not IBS, and that is when I found out I had cancer." A lot of women either get diagnosed very late or not at all, by branding women as hypochondriacs, infantilizing them, passing sexist remarks, etc. The most overlooked major consequence of the dismissive attitude towards women's health is the limited understanding of women's health relative to the rest of the medicine. When researchers study diseases that are more prevalent in women like depression, thyroid disease, and multiple sclerosis, women are often excluded. Researchers tend to avoid using females for fear that their reproductive cycles and hormone fluctuations could confound the results of delicately calibrated experiments. Since the ancient Greeks, a barren uterus was blamed for excessive emotions in women, such as hysteria. Hysteria was a term used to describe and dismiss most female illnesses. Today, women's health is used synonymously with fertility. Understanding health differences is beneficial to all who want to understand the impact of different conditions and treatments on men, women, and communities of color. If women's health and cycles remain taboo, even in this era, then it is time to demand medical equality. The difficulties faced by women in accessing healthcare in India are complex and multifaceted. Overcoming these challenges requires comprehensive efforts at the societal, institutional, and individual levels. Community awareness campaigns can help break the silence surrounding women's health and promote open discussions. Empowering women through education, raising awareness about the health rights, and dismantling cultural barriers are essential steps in ensuring equitable healthcare access for all. Additionally, government initiatives should focus on developing robust healthcare infrastructure, especially in rural areas, and ensuring that healthcare providers receive training to deliver unbiased and compassionate care to women. Moreover, fostering an environment of respect for women's autonomy and rights is crucial in promoting their overall health and well-being. By challenging cultural taboos and practices that hinder open communication about health, India can take significant strides towards ensuring timely diagnosis and treatment for women, improving the overall health landscape for the nation's female population. Only by addressing these issues can India truly progress towards a healthier and more equitable society for all its citizens.